a dairy farm in southwest Wisconsin. I went to a small farming school. I was playing football. Essentially, I injured my neck playing football. I had a herniated disc. I started having radicular pain, so pain down into my left arm, and I couldn't even move my left arm. In fact, it was almost like it was paralyzed. So I went into the Cuba City, Wisconsin local chiropractor. He evaluated me, found a bulging disc in my C5 area of the neck, which would be in the mid part of the neck. He did a couple adjustments, and over time the bulge went away, and I regained function in my arm. So when I was in the University of Wisconsin, I ended up going into the United States Marine Corps. Following a deployment to Iraq in 2004, some of my athletic training friends who were at the University of Wisconsin, they had ultimately gone into Palmer College of Chiropractic. And when I came back, I was trying to touch base with some of them, and I went down to the Palmer College of Chiropractic where they were going through school, and I ended up doing a campus tour, and I had to become a chiropractor. In 2008, I was training for Ironman Coeur d'Alene, and as I was doing my training runs 40 minutes to an hour in, I would develop a stabbing type pain into the left side of my knee. All sorts of physical therapy modalities, everything thrown at it, and I still had the knee pain occurring. My best friend and ultimately wife, Dr. Rosalind Blackie, she had recommended that I try Atlas Orthogonal Chiropractic.
We have since gotten married.
Now we have 4 beautiful children.
I finished the race in 12 hours and 21 minutes. Yeah, after the race, the knee held up. I didn't have any other pain from there on out. So here at SeaTacSpineAndWellness, we absolutely integrate our Atlas Orthogonal technique with helping these patients manage their health care with also their other healthcare providers.
He has a passion and a strength for working with the upper cervical spine.
The beautiful thing about the Atlas orthogonal type treatment that we do, it focuses on the atlas, the very first bone in the neck. And when that atlas is misaligned, it causes major postural issues that cause so many areas of discomfort and pain and other symptoms throughout the body.
Personality-wise, the two of us, we mesh really nicely. He's very much the go-getter, the hard hitter. I'm the details person, and it's worked out really nicely for us.
Atlas Orthogonal is only practiced by 2% of the chiropractors practicing in the world today. One of the nice things about the technique is it's a very safe, gentle, and effective treatment protocol.
Since we opened the practice, my goal has always been to provide treatment for the patient that is very specific to what they need. We're very fortunate to have some very precise and very gentle chiropractic techniques that we've specialized in, Atlas Orthogonal being one of them. We also do activator and a whole host of other things, depending on what the patient presents with. Ultimately, my goal as a practitioner is to make sure that you're getting the most specific treatment for your body based on what your body is telling me it needs. As each patient comes into the clinic, we do a very thorough exam. We do a full orthopedic exam and neurological exam to assess exactly what's going on in that patient's spine. Once I know exactly what the issue is, I can target my treatment specifically to that particular need. And the two of us together do a really nice job